Welcome, everybody. It's Jordan Angeli, founder of the ACL Club, and I am so excited to have you all here, a part of ACL Study Day, in this great Q&A that we're going to have in a really meaningful conversation about the patient side of ACL rehab. If you guys have been on the ACL Study Day curriculum, you saw me talk about my experience and what I have learned through the process of multiple ACL injuries. It was a big reason why I started the ACL Club, a big reason why I am a big advocate about what this process is like and how we can get better and grow from it. And so the cool thing today is I get to be joined by 5 people, a couple of PTs, some going, one of them, I think currently, Christine, I think you are currently going through ACL rehab.
Yeah.
And Robbie has been through it, and the other 3 are in rehab right now too, some younger athletes. You guys, I'm so excited to have you here. I think we have the same order on our screen, so I'm just going to have you all introduce yourself. We're going to start with Maddie, and just give us your name, how old you are, if you play sports or what you do, and how far out of injury you are and in the process of recovery. So Maddie, why don't you go first?
Hi, I'm Maddie. I am 17. I play soccer, and I'm about 2 months out, I think, from surgery.
Okay.
So, yeah.
And this is 2 months from your second ACL.
Yes.
Yes. So, okay. So been through the process before, and Maddie is now on the venture of the second one, which I think has a lot of cool mental pieces to it. So we'll dig into that. Megan, how about you?
Hi, everyone. My name is Megan Hebert. I'm a 17-year-old soccer player, and I'm currently 7 months post-op from my 9th knee surgery.
Oh, yeah. You heard Christine say that. Wow.
Yeah.
That's a lot. And we will talk about just the mentality that it takes to continue to persevere. First off, Megan, you're a champ. Seriously, a champ. A champ. Okay, Brendan, let's go to you.
Hi, my name is Brendan. I'm 20 years old. I'm 2 years out from my, or a year and a half from my last knee surgery, but the full reconstruction was 2 years ago.
Great.
I play basketball. Yeah.
Yes, I love that. Gosh, I love those numbers too. You're in the fun stuff where you start to feel like you again. So, congrats on that. All right, Ravi, you're up.
Yeah, so my name's Ravi Patel, and my ACL surgeries were 13. So 13 years ago, my first one, and then my second one was 7 years ago. And now I've shifted the focus to working exclusively with ACL related patients. So that's where I'm at.
Yeah, show us your shirt, Ravi. The ACL athlete. If you guys don't, if you're not listening to his podcast, go ahead and check that out too. Christine, welcome. How are you?
I'm good. How are you? I'm Christine. I'm 29 years old. I'm a PT. I had my surgery in March, so I'm like 10 weeks out. I used to play track and field in college and volleyball, but now I don't. I just work out. So I'm not trying to return to sport, but I'm trying to return back to everything I was doing before I got injured.
Yeah. I love that. I went through multiple ACLs. So I told you guys I'm Jordan Angeli. I had 3 ACLs. My last ACL actually, this is when you know you're in a good place. It came and went and I didn't even think about it. So that was a really exciting moment for me. It was 10 years ago. So I'm happy to be on this side of it and happy to help you guys just talk through these things and navigate this continued process of working through trauma, right? I think that's really what this all is about and how we can use it and hone it into making it something that is useful for us in the future. So I think I'm going to start with the soccer players who've had multiple injuries. What do you guys feel like has been on the patient side the most difficult part of this process for you mentally? And I know this is a broad question, so I think that there are going to be different things that come up. But why don't we go Maddie and then Megan? What's been most difficult for you mentally, Maddie?
Probably just like staying positive and still like attending things, because watching other people play the sport that you want to play is really difficult, and just like keeping like that positive mindset that that will be me again one day.
Mm-hmm. Yeah. What have you done to help with that?
I usually hang out with friends. I feel like that just like lightens the mood and makes you, especially soccer friends, wants you to come back and be even stronger. So just like hanging out with friends. And then also I do journaling, which I feel like has really helped. So
Mm-hmm. Does anybody else journal here or use some form of outlet? Yeah, that's fine. It doesn't have to be specifically journaling. I think that just being able to get your thoughts out, whether it's to a friend or a parent or a physical therapist. I mean, I'm sure you guys hear a lot of that. Just the ability to vent is so big in the healing process. So thanks, Maddie. Megan, how about you?
I agree with everything Maddie said. I think just I've had a lot of complications along the way. And I think just picking yourself up after those complications has been really, really hard. And like going to like a doctor's appointment and just hearing like, okay, your ACL graft failed. Like that sucks. That's complete devastation. So just picking yourself up and trying to keep going and trying to stay positive.
It's so difficult. And I think you can take that as, that's a big thing over a long period of time. But I think that same concept happens all the time during ACL rehab. And Christine and Ravi, you probably see this a lot, is when patients are progressing and then you either plateau or you regress a little bit. How do you guys as physicians help or clinicians help patients to know that that's part of the process, to deal with these ups and downs, and while always saying it's okay to feel emotions, right, Ravi? It's okay to feel those emotions, but also it's okay to be positive too and know that it is going to get better.
Yeah, no, that's a good question. One of the things that I start off with any patients that I'm working with is huge to set the expectations and knowing just that time frame, right? So you're going to be at least like a 6-9 month process realistically, and setting the expectations, knowing that it's not just going to be this perfect like linear line. And it's that saying of like what we think it's going to happen, and it's that line versus the reality of it. And it's like this up and down process. As long as that trend is going up is the biggest thing. And I think that's one of the things that I focus on most initially with a lot of my patients.
Yeah. Christine, Ravi brings up an interesting point here. And I actually I want you, Brendan, to answer this too, because I think it's interesting from a PT standpoint and an athlete standpoint. Timelines are hard, and mentally they can be encouraging, but also discouraging. How do you balance that as a physical therapist, saying, okay, I know, now you know what it's like to be a PT and to progress somebody through the process, but you also are in it now and know, okay, well, like Tuesday, I can't do that. Like I'm not checking that box and moving on. How do you deal with that idea of a timeline?
I think that was like the biggest reality check for me, because you're like, especially when you're treating patients, like you always want to make sure your treatment is organized and you're like, okay, I'm hitting this, I'm hitting that. You want them to feel like they're making progress. But when it's you and you're feeling it every day, you have to like have a conversation with yourself and just be like, okay, like it's like today I did this, but like, you know what, 2 days later, it didn't feel the same, or like next week it wasn't as good. But it's like, it doesn't mean I'm not going to ever get better. It's just like every day is different. So, like focus on the things that you can control and just like don't be so hard on yourself. The timeline is also like, it's a blueprint. It's not always going to be the same for everyone. And like, because I'm not a high paid professional athlete, like I'm not in a rush to get back on the field. So I'm like, no, nobody's losing a contract over what I'm doing. So, like I have a whole year to get it right. Just like take my time, like, little things, be happy that you're able to do this and just keep like moving forward. So.
That's so good. Even me, as I at one point I was a professional athlete and I did need to get back. And that was my third ACL. And I felt like, wow, I just want to be healthy again. Yeah. Right, Megan? I'm sure everybody just nodded their head, right? I want to feel like me again. Brendan, for you, you're now a year and a half out of surgery, correct?
Mm-hmm.
And did you feel like timelines were helpful for you as an athlete? Did you feel like knowing, okay, by 3 months, I want to do this, by 6 months, I want to do this? Did that help you to set those goals? Did you feel like they were also detrimental in some ways? How did that process work for you?
Well, yeah, for me personally, like it was more of I'm like being athlete, you're competitive and you always want to strive for those goals. And you can really grind on yourself by trying to accomplish those goals by that set timeline you set yourself. So
Right.
I always had to remind myself, like last week I wasn't able to do this, but I was able to do it at least once this time. Maybe let's strive next week. Let's go 2 times, 3 times, instead of saying, oh, I did it I did it once. I can do it every time now. That's not how things work. Like, oh, it's like just relating to sports. Like, oh, you kick a soccer ball into a goal. Oh, I can score whenever I want. But then you put a defender there. That like it's just something different, and you just have to remind yourself about that every time.
Yeah, I love that. That's a really good point, and I think something that helps with those ups and downs in that process that Ravi. Have you guys all seen that video of like how you think, or that image of how you think things are going to go, and it's a straight line, then how it actually goes, and it's like a cluster of a line. It's really what I think Ravi was talking about, and what you're hitting on there, Brendan, is that everything is progress, right? Even if you can't do something, you're progressing, because maybe, I don't know, Brendan, was there a challenging part for you in the rehab process where you kind of felt stuck? And how did you find yourself getting through that feeling of being stuck?
It was more just like the weakness and the bending, obviously, with coming back, like when you're starting to do like body squats and stuff like that, where you're starting to get the full range of motion. And you go from one leg to another because you're doing a bunch of single leg stuff. It's just always remind yourself, like that was the main tough thing for me, was just like I forgot what I was saying. Like the strength difference. It's just that was a big thing for me. But yeah, I mean, just realizing that this was an injured leg, and it was
Yeah. How do you guys talk to your leg? I like that you said that, because do you guys talk, do you say it's my injured leg? Do you say it's my bad knee? What do you guys say? I'm just curious.
I sometimes call it my bum leg, just like when I'm like, dang, my bum knee. But then, I'm just joking. But then when I'm like working and it's doing good stuff, I'm like, yes, knee, come on.
Right.
But like, yeah, you can sometimes you just like, you talk to it when it's going well, like when I'm like increasing my strength, I'm like, yeah, like you feel it. You're like, okay, like I'm getting some normal movements. And then other times I'm like, where are you?
Yeah. I'm similar to Christine. Bum leg, especially on the days where you're just like, what are you doing? Just like looking down, and just for that reason. With other athletes, I'll try to get away from the bad and good connotation, just because mindset, I'm sure we'll talk about this more, but mindset's so big. So if you continue to allude to it as the bad knee, it'll always be the bad knee. So instead, maybe injured or like the bum knee for right now is okay, but just those words.
Yeah. Megan, I'm curious about you, because you've been through a lot of injury, a lot of surgeries on the same leg. What do you think about your leg? What comes to your mind? Because I'm sure, and it's okay, right? It is probably a very difficult thing to think of this knee as a powerful, strong, capable knee, because it's been through a lot of things, and you've been through a lot.
Yeah. So this is going to sound terrible, but my family calls me Peg Leg Meg, because my name's Megan. So that's wonderful. But I call it my $1 million knee, because I mean, after all the surgeries, I'm sure it adds up to $1 million.
Yeah. I like that. You put a price tag that's like not unachievable, but it's a high price, right? Yes. Like this knee has been through a lot, and it will be better at some place, right? Does it bother you that your family calls you that? Do you think it's funny?
I'm used to they just joke about it.
Yeah.
I'm trying to lighten the mood a bit, but
Right, which is so good, right? I think Maddie was talking about hanging out with her friends, right? It's so good to lighten the mood and just not think about your knee for a little bit. But yeah, I think it's important to understand how powerful our words are and how powerful our thoughts are about our knee. And I personally found a big shift in I told you guys my last injury recovery. I was just like, I'm done with trying to get and produce a timeline. I'm done with it. I understand that I should be here. Like I knew the timeline. I had been through it 2 times already, right? I knew the markers that I needed to hit, but I was over hitting markers and I wanted to feel like inside my brain and my heart, I wanted to feel like Jordan again. I wanted to feel like just healthy. And so that became my goal. And I started talking to my knee different. I kissed my knee too after workouts, which is so weird. But also it has created this appreciation between me and this body part that has been very difficult for me to get through in life at times, to say, hey, I appreciate what I've been through and what you've put me through and where we're at now. And I understand we're all at different places with our rehab and maybe don't feel like, gosh, I love this knee. But once I changed the way I talked about my knee and about my leg, I feel like it did help shift my mentality. Is there anything that you guys think when I'm talking about just little shift that you have had that you feel has aided you in your recovery to find a positive amongst the negatives? Have you found that at all, Maddie?
I'm sorry, can you repeat that again?
I just was, I said, has there been something that you found that you've been able to shift your mentality in a certain way that has really helped you?
Yes. So I go to Loris with Julie, and this kind of goes back to what we called our knees. At the beginning, I could not look at my scar one bit. And Julie just kind of was like, you have to look at it as like a healthy leg. And ever since I did that, I feel like I feel more strong, and I don't know, I feel like that definitely made a big impact, because compared to the first one that I had, I always just looked at it as the injured leg. And I felt like I was always just like, it was always an uphill battle. But now it just feels like, I don't know, it seems easier.
Right. I think Brendan goes to Loris too, don't you?
I do.
Do you guys know each other?
Yeah.
Are you guys ACL buddies? Do you work out together ever?
We've seen each other a couple times, but we haven't.
Okay.
We're not buddy, I would say, but we say hi to each other.
Yeah. Well, I feel like that's and the PTs here too probably have seen that just when you have ACL athletes in clinic, how they support one another. And they ask, hey, where are you at? What part of the process? Oh, I remember that. I remember being there. How have you seen that community? I mean, Ravi, you work in ACLs primarily. How do you feel like the community is a big part of it? And even just this discussion, like being able to share and hear each other, how that is in the healing process?
It's huge. It's really hard to gain the perspective of someone who has gone through this process. So being able to talk to other people who have gone through this is huge. So for PTs who are trying to learn that, it's incredibly valuable. But the community of being able to see someone, like if you see like a scar from, I think we talked about this, but if you see someone and they've got a scar on their knee, you're like, I know you, so it's really cool to be able to know that there's this community of people, and how long this process is and how the ups and downs, and there's a lot of internal things that people don't see that that someone else who has gone through this process has shared as well. Yeah,
absolutely. Anybody else with that have had good experiences just talking to somebody else who's been through ACL recovery process that want to share that?
I think like the post-op brace that you see, if you see someone wearing that, you're like, oh, you've had an ACL reconstruction.
Yeah.
It's a big thing.
Yeah. For sure. Yeah, my friends said the same thing. Two of my friends had their ACLs done, and they're like, "You're gonna see it. People are just gonna be waving at you across the street when you're walking around with that brace." They're like, "Yep, ACL. I've been there." And
Yeah.
everywhere I went, they're like, "Oh my god, that was me a year ago."
Yeah.
It's gonna get better. So it's just
I know.
Yeah.
And it's so nice when you're on that side and you're hearing people say that, right? Like you just feel, I think one of the hardest parts, and maybe why this ACL community, if you see a scar, you don't know at what point in the process that person is, right? I felt, and I don't know, maybe one of you three younger people can talk about this, but I felt like at the beginning when I physically looked like I was injured, I felt more supported because people were like, almost to the point where I was like, okay, this is enough. Like, I don't want your pity. Not that it was pity, right? But like, we think we're strong and we don't need help and all these things. And then you get to a point where you look normal and you can walk and you can run and people just forget about it. And you're like, but I'm not there yet. I'm not even close. And I feel like I don't have people that support me. So did you guys find, Maddie, Megan, and Brendan, we'll go in that order. Did you guys find the later stages of how to do more normal, made more, I don't know if lonely is the right term, but maybe did you feel supported because you didn't look injured?
Yeah, so I feel like towards the end, you're so close that you're like almost too eager, I feel like. And I don't know, I feel like so much can happen in that little time. And if you don't have the support, you kind of like overwork yourself just to like feel, how to be back. Yeah. So I just think it's very difficult and people kind of forget. They're like, oh, she's close. She doesn't need the support. But I feel like the last stages are the most tough mentally too and physically.
Mm-hmm. Yeah. How about you, Megan?
So for me, it was kind of opposite because of all the complications I've had. One of them was femoral nerve damage where I couldn't lift my leg for a whole year. So I had everyone like saying, when are you going to be able to lift your leg? Like, that's not right, blah, blah, blah. And I was going to school every single day. So it was really hard for people to be like, well, when are you getting the brace off? Like, when is this going to happen? I'm like, I don't know. Because the surgeon told me, he's like, we don't know when you'll be able to lift your leg again. So that I was like, I don't know when I'm going to be able to do that. So that was really hard to like, I didn't have a definite answer.
Wow. Was that from a nerve block?
Yeah.
Yeah. Which I think is an important thing to talk about. I didn't have a nerve block for a few different of my surgeries, and then I did in the latter stages. But I think it is important to understand every decision we make has, it is a major surgery and there are consequences. And, I'm sure, Megan, for you in that year, it was really challenging to hear that over and over again from people. Was there anything that you did to say, hey, I don't know. How did you communicate with people to say, like, I'm in the same boat? I don't know, but I personally can't deal with all these questions. Like, that's how I would feel. I don't know if that is how you feel.
Yeah. I wouldn't explain to every single person what happened, obviously, but right. Like, for the people, like, especially that I was close with, they had a lot of sympathy for me because like that was really devastating. Just like something so simple, being able to do a straight leg raise, like, was so hard for me. So I think just explaining that and then just getting some kind of sympathy for it really helped. But the other people that were like, there were people like talking behind my back about like how I was like faking it. I'm like, I've had so many surgeries. I don't think you can fake that. But it was really hard, but I kept going. That's all you can do, really.
Yeah. Thank you for sharing that. That's, I think it is powerful too at certain stages we all go through this rehab. And one of the things that I think we all can agree that we learn the most is how to communicate. Not only everybody's like, because it's empowering, right? To communicate properly with your family, your physical therapist and your teammates and your coach. You don't have that communication. We have thoughts of their own, and they don't know how to approach you in certain areas. And so by just saying like, hey, this is where I'm at, I can't deal with this right now. And it's not you, it's me. I'm going through a lot. I remember telling my team, like, I was a captain. I was like, I can't do this anymore because I am not fully here. And I love you guys and I love your support. But if I continue to do this, I am going to be detrimental to myself, which therefore isn't helpful to you. So just learning to communicate is so empowering, and it's uncomfortable at times too, which I think is why it is really empowering. So Brendan, do you have any thoughts on the last question the girls answered as well?
I think it's nice to have, like, at Loris, you're working out with athletes that are, in the, like, they haven't had any injuries or anything like that, but you're also working out with people who have. And it's always fun because, like, you always see people, like, they see you, like, kind of mature and grow. You're doing different things. You're actually starting to look like an athlete again. And they'll be kind of watching you from the sidelines, and every once in a while they'll be like, hey, you actually kind of look like an athlete now. Like, before, like, you could tell that you weren't, like, at yourself, but now we can truly like see you. And it's just, like, kind of reassuring. I mean, like, that was a really positive thing for me personally, was getting it from other people than my family and my therapist and stuff like that. Because they always say that, and you always, like, in the back of your head, you're always saying, like, they're just saying that to keep me positive. But when you see it from someone else, like a stranger, and they come up and say that, it was probably one of the most positive things to happen to me.
That is such a good point. And it makes me think of perspective, because your perspective, Brendan, was, I'm in physical therapy. I'm doing this every single day. And yeah, you can feel growth, right? You can feel it, but you don't always see it. And so then you pull back and you see this grander perspective from somebody else's point of view that has only seen you at little blips, right? Like, seen you 2 weeks ago and then seen you now. And they're like, go on, Brendan. Like, you look good. And it's cool to have that change of perspective, because I think it does get you out of, like, the grind of every single day. Because we all know that it's a grind. You guys, this has been so fun, and we have so many questions. I haven't even gotten to any of the questions because I've just been rolling here, but we're going to get to some of them. You guys submitted, if you're watching here, you've submitted some questions, and they're really, really good. We're going to start with this one it's to Ravi and Christine here for the PTs. Do you guys find it valuable to share your own experiences with ACL injury and rehab? We'll start there, and then I think the second half is for the patients, saying, do you find it valuable when you know your PT has gone through this rehab? So Ravi, why don't you get us going?
Yeah, it's huge, I think, to be able to share the perspective, especially going through the process yourself, the relatability. And if we're talking about communication, there's nothing that creates more buy-in than being like, I've been through this process myself. Right. And even if you're not a PT who has not gone through this process, being able to kind of relate to that aspect is really important to know. It's not just a typical shoulder pain injury or something like that. It's just it's different. And every one of us here can vouch for that. And I think sharing, especially if you've gone through it yourself, sharing that and knowing, especially when those times are really low, to be able to show, like, hey, I went through that myself too.
Yeah. I agree. I definitely think it changed my perspective after getting injured, because this is my first ever injury. So with patients, when you're talking to them, it's, like, very easy to just go off textbook or just, like, prior patient experiences. But when you're with them, and, like, even if they're not in the same age group, but, like, they're active and they want to get back to things, just, like, taking it outside of the clinic. It's not like, okay, your exercises look great, but, like, how are you doing in your, like, everyday life? Like, how's sleep going? Like, how is it, like, getting in and out of the car? Like, what is it like when you're with, like, during social events? Like, little things like that. Because in PT, I feel like we become, like, we're so focused on functional movements, like with exercises, but, like, your movements are much more extreme outside of that. So, like, being able to check in with your patient at, like, different levels and just communicate and, like, have those stories resonate with them, I think, like, makes their experience a lot better. Like, they trust you more.
Yeah, I want to get back to that because there's something in there that I think we can dig into a little bit more. Let me go to the other three really quick. Did you guys have physical therapists who've been through ACL injury or injuries, and does it help you as the person going through it now to have your PT share that information with you? Brendan, you want to start, and then we'll go backwards. Brendan, Megan, Maddie.
Yeah, I don't truly remember if my physical therapist if she tore her ACL or not, but I mean, she's dealt with it multiple times. So I mean, she's rehabbed also many other people. So I mean, it's just more of going off of those, I would guess. I don't know for sure, so it's a tough question for me to answer.
Yeah, Maddie's shaking her head too. I don't know if she knows, because you both work with Julie, right? Or you worked with Julie.
Yeah.
And but Julie's brain for these things is just so incredible. And I think one of the things that I love most about physical therapists is their ability to always seek something more and say, okay, what else? What do I need to learn? What do I need to know that is a way to do this differently or better as I did last year, or like that constant growth? I'm sure that's something that connected you with her.
Mm-hmm.
Yeah. Megan, did your physical therapist go through?
I've had 3 physical therapists. I switched 3 different times just to find like the right PT, especially after having so many complications. It was really hard to find someone who could cater to what I've been through. But the one that I'm with now, in the past 2, like, no one has been through an ACL surgery, but they've worked with a ton of athletes. And especially the one that I'm with now has actually like worked with the Patriots, because I live in Massachusetts. So that's been really cool to go there and be like, oh, you've worked with like Tom Brady or something like that.
Yeah. That's great. Megan, I do want to, before I go back to Christine, I want to talk to you about that, because I switched physical therapists as well. And I feel like it was one of the difficult conversations for having to come to terms with, like, I have to move on. Like, had this, the definition of insanity is doing the same thing over and over and expecting different results.
Yeah.
I was like, I can't. I have to switch. And it was, again, it's nothing to do with that PT. It just didn't. I knew it didn't serve me. How did you personally know that it was the right time to switch to somebody different? And how did you go about that conversation? Because I think there's going to be people that maybe hear this, that are PTs, that hear this information and feel maybe hurt that that person switched from them. But there's also maybe people listening that need to switch, and they need to feel like, I feel empowered to do what's right for me.
Yeah, so I felt like I was going through a breakup. And that's kind of traumatic, but I was like, I can't do it, because my first PT I was with for 2 years, I want to say, and it was terrible. They were with me through like surgeries 1 through 5. But after my ACL reconstruction, where I faced all the complications, I could tell they were getting frustrated as much as I was, and I just knew that it was time to move on. And I went back and forth every single night for like a good month. I was like, do I switch? Do I not? And I think switching and getting a second opinion, per se, was really, really good for me, because that day that I had my second consultation with a new physical therapist, I could lift my leg again. And that was after 1 year. And I was like, wow, I didn't know I could do this. And just having that was really rewarding. And like that PT at the time was like, you couldn't do this before. So it was like, yeah, like it was so challenging. So, and also like creating a bond with a new physical therapist was really, really hard. And I had to like trust the process. So yeah.
Oh, I can relate to that so much. And just, I think at the end of the day, the thing is, we get one life, and nobody knows what our process is like except for us. And so if in your gut, you're feeling, I need to move, I need to go to somebody else, know that that is a valid feeling. And listening to yourself and pursuing whatever is next can actually allow you to maybe break free from something that was holding you back and saying, okay, I have a hand in this really like a product. At least I make decisions that make me feel like I am putting myself on the path that feels right to me. So I just commend you, Megan, like that. I know those conversations are hard and it takes a lot of and communicating with your family and all that stuff to make those decisions. But I'm glad you did that for you, because at the end of the day, it's your one life you get to live, right? You have to stay true to yourself. Yep.
I will add
Christine,
that,
go ahead, Meg.
I will add that the insurance companies, like, they will cut you off. They will say no more PT for you. And I remember that was another factor. I switched PT clinics, and I don't know if they're insurance based, but I got approved more visits. So at this new place, that was really helpful along the process as well, because I needed more PT, and I still need PT 4 years later. But yeah. That's a really good point. And I know that a really difficult thing for me was understanding that I would have to continue to invest in this beyond, unfortunately, beyond my insurance, that I had to say, okay, if I am going to be healthy again, I know that this isn't done because PT says it's done. Like, I know I needed more, and that's difficult. And I know that everybody's life provides different financial means, but knowing that, again, it's an investment in your future and your health and all those things. So that's a really good point of gosh, I don't want to get into insurance, but it's a good point. Christine, you mentioned something, and it is something that you wrote into, and I was kind of getting to know you guys before this idea of, we go to physical therapy and we hit these markers, but no one's like, how do you get in and out of bed? Like, how do you go up and down the stairs? Can you talk through that and how that has changed your approach as a physical therapist, and maybe something that can be helpful for the PTs listening, or even the people listening that are going through rehab right now, to say, oh, maybe I should ask about this, or maybe this is a good exercise to have them do that is working the same muscles, but is a real life almost hack to say, okay, this will help your life be a little bit better.
Yeah, I think I definitely noticed it more, like, because I did prehab before my surgery. So, like, during the prehab, you are progressing way faster, because even though your ACL is gone, everything else is intact. After the reconstruction, now you've moved things around, and there's, like, your body's been open, and now you have to heal. So, like, it wasn't just like, okay, now you can do a straight leg raise, you don't have an extension leg, let's just start, like, walking. And then I was like, I'm walking with this crutch, I'm like, I'm walking crazy. I was like, I'm walking down the stairs, I'm like, I'm walking crazy. And, like, I had my crutches, and I had like 16 steps to get into my house. So I would like throw my crutches, like, so I could get down if I'm like in a rush, and I'm like, I have to like use like my one arm, and I'm just like, this is nuts. I'm like, I'm gonna like hurt my shoulder, or like hurt my hip. So
Right.
like then I'm in my PT, and my PT's like, oh wow, you're like getting so much stronger. And I'm like, I don't feel strong, I can't do anything. And so just like, checking in, like getting out of bed, like I would be like, okay, how do I feel in the morning? Like how I would get out of bed, I'd be like, okay, let me try not to like keep my leg up in the air. Like I would like straighten my leg and lift it and like slide it over. And I'm like, okay, that's not how normal people get out of their bed. So like just challenging myself to like bend my knee like when I could bend it, and then like get up the way I would normally get up, or like, redoing things. Like when I get out of a chair, I'm like, okay, am I leaning over to one side? Like sit back down, do it 5 times, like see how it feels. Like just testing yourself in those aspects. Getting out of my car was really big. And like walking, like I would practice just walking in my complex, just like walk and then stop thinking about it. Cause it's like when you're teaching someone how to walk, it's so weird. It's so robotic. I'm like, I was like, just stop thinking and just walk, because like you're taking so much time. So it's just like, talking about those things with patients, because it's like we learn certain cues, and we're like, okay, squeeze your quad, or like, really try and straighten your leg when you walk. But it's like when you're in a crowd or when you're in a rush, those things go out the window. So just like, I think being more specific with what your patients have to do, and then also like kind of like letting them relax. Like don't think about so many things. You're just going to like make it more complicated than it is. Yeah. Those are just...
And I slow down too. We think we're gonna just like way, like, oh, I'll just be working again and it'll be normal. But if you can slow it down, it helps you feel what it feels like on the other side, so you can almost mirror that on that same side. Do you guys have any hacks that you've acquired through the process of things that were really helpful for you in rehab that you're like, oh, nobody ever talks to you about this, but this is something that's helpful?
Videos. I think using your camera. I was using my camera to like take videos of myself. I'm like, let me just see what I look like when I'm walking, and I think I'm walking normal. I was like, let me see what I look like when I'm getting out of the gym, and just like that.
Yeah, I love that. Brendan, did you have anything?
It would kind of be the same thing as Christine was saying. It's kind of like mirrors too when you're working out. Like just going in front of like a mirror when you're like, oh, you walk by a mirror, like let's see what a squat looks like right now or something like that, or just kind of like looking at it almost, and like, I don't know, it's just little tiny things. It's not anything big for me.
I love mirrors. You like kind of feel vain at first, but then you're like, no, I look good in these squats. I'm going to tell myself I look good because this has been a long process and I need the positivity, right?
Totally.
Maddie, how about you?
I'd have to say the same thing as Christine. I had trouble walking because I think I was just like thinking about it too much and I was like breaking down the motion, so I looked kind of like a robot type of thing. And so watching myself walk, I was like, I look like that. It's just like seeing it from like another perspective and being able to then just put the motions together and be fluid with it was a lot easier after I saw myself walking.
Yeah. Megan?
I think like the videos are very helpful as well, looking back, because you can see how far you've come along the process. And you can even, I'm planning on making a whole video about everything that I've gone through. So I'm excited to see how much I've progressed.
Yeah, I love that. Ravi, do you have any hacks?
Ooh, hacks. No, probably using the crutches, I think, in different ways, whether it's even just like a leg prop, you got the little hole thing. People,
I just found that out. I was like, that's amazing. So smart.
Or even just whenever you're starting off in the initial phases, using your crutches as much as you need, but then because we're trying to get away from them so fast, that like, talking about the gait or learning to walk, not trying to ditch it too fast to where we're trying to over rely on our knee at that current moment. So using the crutches as much as we need. And then once that stuff kind of normalizes, we can ditch them.
Yeah. Yeah. My hacks are like at the beginning. I think wedge pillows, like buying a wedge pillow and propping your leg up is like something people don't think about. A shower stool. I know, like to put in your shower, and a handheld shower thing. So you could do something that like is so normal, right? I think those are the hardest things, like the normal everyday things that you just can't do. I remember crying when I couldn't carry a glass of water from the kitchen to the living room. I'm like, why are you crying? Well, it's just a normal everyday thing that you can do all the time and you can't do it. So, and the shower stool also, like, I feel like helped when I had to go to the bathroom. I could like prop my leg up so it wasn't so much pressure on my knee. I think of like those things that really helped me that are easy, like something to get right at the beginning that make you feel a little bit more comfortable and like you can have control over certain things. But that goes here, love such things. Okay, let's do some of these things. You guys can tell I can just asking questions off of what you say. We had a question about how important is it to still make practices and team meetings throughout the rehab process? And I think this will have a variety of different answers. So Maddie, do you want us to start us off there?
Yeah. So for my first ACL, I like attended everything. I still went to like a lot of the out of town tournaments and I attended practices and I thought it was nice, but it was also like just like, I don't know, it didn't sit right with me because watching people play just kind of like brought the mood down for me, I guess. Like it was nice to see my friends, but going to everything and seeing people play and I can't do that kind of stuff. I don't know. I felt like that kind of like hurt me a little bit. And then so the second time around, I maybe go to practices once a week and then a couple of games on the weekends. But I feel like I'm in a way better mindset. I don't know why, but hanging out with friends and not worrying about the soccer part of it, I feel like just like helped me see a positive outlook on it.
I love that. Megan?
For me, it's really hard because everyone would ask me, when are you coming back? When are you going to get back on the field? I'm like, I don't know. Maybe after the next surgery. But now that I'm like at a place like 9 knee surgeries later, I'm really, really missing soccer. So I haven't been to a practice or a game in like 2 years, but I kind of want to start going back. But I'm a junior in high school right now. So once I'm going to try to play soccer for my senior year, hopefully, fingers crossed. So I hope that this summer I'll start going back to practices and stuff.
Okay, good. I love that. Brendan, how about for you? I know are you fully integrated back into playing and you're playing basketball and you're feeling good?
Yeah. Like this past year was when I really felt fully normal, but going to team meetings and stuff like that, I was in high school when I tore it, so it was my senior year. So it was really tough because like it's my senior year. You're supposed to be at like this is like when you're supposed to be your best. Like this is when you feel like you're the best. But like going to practice, I would literally have to read a book at practice. I'm just like, I can't watch this, but I want to be here for my team. So I understand that battle. But that was just something I did where I'd really have to distract myself until I kind of started to become normal with it and kind of like accepting it more. But yeah, I went to everything. It's just a big mental game. You kind of have to play with yourself, reminding yourself like, this is what I love. This is what I want to be. This is where I want to like go, but I'm not there yet. So it's it was one of those things for me.
I think that you bring up a good point too. I talk about the grieving process often because there are stages to this, and like denial is a stage, right? Like we all go through that where we're like, no way, why me? Why did this happen to me? I don't want to be here. And then we go through anger and we then accept that this is what we have, this is the path that we have. And from there, we feel like we can choose what's next, right? We can choose our attitude going into the next thing. Not to say our attitude is always perfect, right? I think that's the beauty of being a human is we get to feel these things. And if we constantly suppress the feelings that we have, it makes the healing process a lot different. I'm curious, Brendan, because I know most of us we all grew up as athletes. We all played intense sports growing up, right? And the thing that was really difficult for me is physically, like I could, we can do anything, right? We all can look at each other and be like, oh, you tell me to do that, I'm going to go do it. But the mental side, even if we think we're, strong mentally as an athlete, like I can push through that sprint progression that we have to do. I can be there in the 90th minute, making a sprint down the field, like all these physical things that we think that's the mental toughness. I think mental toughness is so different than that. How did you find you grew mentally stronger, Brendan, through this process? Because I think as an athlete, we're told like, work harder, tough it out, man up, all those things that are really, you don't feel like you're strong if you don't feel those things. And I think that that's an illusion of strength. I think strength is actually all these things put together. And I just am curious if you felt that tension of having to be strong, but at the same time feeling your emotions and saying, all right, it's okay to feel these things.
Yeah, I would say I totally agree with that. It was a big thing that I learned was patience. That was the biggest thing I ever took away from this, is being able to be patient with yourself, but also be patient mentally, telling yourself like, I still have this much to go in my rehab, but then also being competitive and doing all that stuff and telling yourself, the athlete in you, to push yourself too. So
yeah,
the main thing I take away is patience.
yeah, I like that. Ravi, I'm going to go to you next because you have gone through the experience and you're also now helping people through ACL rehab. And there are moments where you're like, you can do this. You can. And people are scared. You know, it's okay. They're fearful of doing something they've never done or saying, can I do this? How do you walk people through that emotion of saying, all right, physically you're there. Now we need to work on you believing that you're there?
I think really trying to frame it in the sense of these small wins as you're working with different athletes and different patients. The small wins are big. And, you know, if you as a PT should have a good gauge of the person, of the patient, and know what they are capable of and what they're not capable of. And the biggest thing that I would stress here is knowing the athlete, like knowing the athlete and knowing, are they someone who is going to push themselves and you got to kind of hold them back a little bit? Or is it someone who's going to kind of overdo it because everyone here is an athlete. So usually when you get challenged, you're like, I'm going to do that. Right. Like, but the thing is, as a PT, you got to know where that it's a fine line. And if you know that they're physically there based on the rehab and the training that they're doing, then sometimes you do need to give them that nudge and be like, look, you can make this happen. And and maybe there's videos, you know, now like using video so much, being like, look, you've already done all of this. This is just one little step further. Yeah. And you can do it. So encouraging them that way and knowing where they've come and where they're at now, I think is really big.
That's good. And it brings in that patience too, that Brendan was talking about, patience, small wins. I'm a big stickler on small wins. I'm like, those little things just add up. And before you know it, right? So I have a question from someone, that a couple of like real mental questions. Somebody asked, do you have any feelings of hopelessness throughout the process? And I think that I'm going to combine that one with this thought of, do you have any tips on the mental side? So if you guys want to answer this question, feel free to just tell me. I'm not going to call on everybody, but I think this is challenging, right? This is a hard process to feel, you know, some people go through it and it's fine, but some people, there is feelings. I know I felt hopeless at times, and I felt like, man, I don't see it. Like, I don't see the light at the end of the tunnel. And I can talk about the things that I did to help me on the mental side, but I'm just curious if anybody wants to take that and talk to that a little bit. Brendan, all right. Oh, unmute yourself. That's right. We've all been there.
Yeah. I would say when I first heard the news that it happened, and like for those first weeks to first month area, you really feel like you're on an island. You don't really have anyone. You have your family around you, but none of them know exactly what you're going through. Like you might have uncle or something that's torn their ACL too, because it's very popular. But like every circumstance is different, and you know that. And one of the things that I did was kind of like what Maddie does, is that you go hang out, you kind of take a step away from it too, and kind of go hang out with friends. Like even if they just come over to hang out with you, just having other company and seeing other people is a really big thing. And them also giving you compliments. Oh, you're out of the brace now. Nice job. Like, are you walking? Like stuff like that really helped me personally. So
yeah. I love that. So on the mental, you know, you felt the hopelessness, but being around your friends really helped you mentally to understand you're still just one of their friends. Like you're not any different because you can't play your sport, which I think it makes us feel different, right? When we can't participate in what makes us feel so alive, we feel like we're not us anymore. And that's not how your friends make you feel. And I think that's a really important thing to recognize.
I agree. With like the beginning, like when you found out, like when I found out, I was like, nah. Like when I went to the ortho the first time and he did the Lachman stuff, it was him and his resident, and the resident was like, oh, I got an Enfield, and the doctor was like, no, it's torn. And I was like, I don't think it is. And he goes, we'll see. Like on the MRI, he's like, I hope it's not. And then I got the MRI and he's like, it's a complete tear. And I was like, what? And so then I kind of was just like going through like, okay, how far can I get without this ACL? Like, let me like do studies. And like, as a PT, I'm like, it does look crazy if I'm like telling people to go get surgery and I don't get surgery. But I was like, let me see, because I already had a lot of mobility in my knee before. And then as I was going through the prehab, I was like, my knee feels fine. I literally don't have any pain. I can jump, I can run. What if I just don't get the surgery? And then I think just like coming to the acceptance, like you need it. Like later on, I'm not going to be young forever. You know, like I don't want to be in a situation where I can't do something because of my knee. So I think like accepting that, like, it's okay. Like, it happens to everybody. It's not like it's uncurable. And then like figuring out a plan that you feel comfortable with going forward. Like I think taking control of the situation for me made it easier. And then like setting up little goals, like the little wins help a lot. Like just like, okay, you know, that first week, let's just focus on these things. And, you know, just like getting yourself okay with where you are, like accepting that it's like, fine, you're going to be all right.
Yeah. Acceptance is so huge.
Oh, you can go. Sorry.
You can go, Maddie. I'll go.
Okay. So I agree with what Brendan said. The first week is just like torture. And when you first find out, you're kind of in disbelief going back to that. But I would also say a part of when I felt hopeless was probably during like after you get to like the biking, in between the biking to the running, just because I'm in that right now and it's all strength training. And I just feel like I'm not getting anywhere, you know? I'm just doing the same exercises over and over and it's just repetitive. And I'm like, am I even getting stronger? So I feel like that's definitely hard. But then seeing like, so I had a physical therapy session on Thursday and just kind of to see the growth between the strength training and kind of thing. And seeing that, I felt like really made me finally feel like, oh yeah, I am doing something right, you know?
Yeah.
So.
Yeah. That part of the process is hard. I would agree with you. Go ahead, Megan.
So my first ACL tear went misdiagnosed for 3 months, and I kept on going back to the doctor. I'm like, something's wrong with my knee. Like, it's not supposed to move like this. And I was kind of brushed off for a while, but I ended up switching surgeons, and I really advocated for myself. And I think that's a big part of the process. If you feel something's wrong, you have to speak up and advocate for yourself.
Yes, you do. I love that. And I mean, I don't love it. I hate that happened to you, but I love that you grew from it, that you said, no, this isn't okay. I'm not okay. Again, you're the only one that knows your body. And I think both those PTs right here can attest that. They probably say that to their clients all the time and say, hey, you're the only one that knows what it feels like. And you do have to trust, build that trust with your PT and with your doctor. But I'm proud of you, Megan, for sticking up for yourself.
Thank you.
Can we talk about the return to sport really quick and the idea of working through that end range? I know Megan or Maddie, you've been there. Brendan, you've been there as well. And how difficult was that for you? Or did you feel like PT set you up and you felt comfortable where you were at from PT into integration back into sport? And how did you navigate that? Because it's not just like, I'm cleared from PT, I'm playing like a champ again, right? It is still part of this whole entire growth. So how was that for you, Maddie, the first time going through that?
So the first time I went through many physical therapists. I had just the regular clinic type of physical therapist, and then I finally found Julia in the end. And I feel like Julia really just helps set you up, because I think she talks to you more about the mental side and getting over those hurdles and stuff. And I feel like she integrated me into the back to play very smoothly. So.
Mm-hmm. Can you talk specifically to some of those? How did she talk to you? Because there's PTs on here right now that are probably oh, well, I need to do that. What can I use? What did she say to you that helped you feel like you were overcoming those barriers?
It's just the praises, and Julie also went to a couple of my games when I first started coming back, like a high school game and stuff, and like her complimenting me, saying like, "Oh, you look like an athlete. You looked good out there." I just feel like those little comments just like help boost, even though they're so little, it just helps so much with the confidence. And I feel like confidence is a big key when coming back to play, because you might be ready, but mentally, if you're not, it's just not the same. Like you're more likely to like what's the word, like stutter into something and not be 100% sure, and then you're more likely to hurt yourself again. So
yeah, Ravi was smiling with that, like, yeah, go to their games, give them confidence. Yeah. Brendan, was that a difficult part for you, integrating back into sport? Did you feel set up? And
yeah, there's always that hurdle of actually starting to actually play. Like you can run around, you can jog around and like do warm-ups with everyone and feel kind of normal, but then actually going into real live sport, like contact sport, is way different. That's the one thing that I had a little bit of hesitation with, because like when you think about cutting and you're with or like just moving around, you think about like, oh, I gotta like flex this leg, I gotta like really focus on bending it. But when you play, you're going back to how you thought, like, oh, you're worried about what's going on in front of you instead of worrying about what's going on with your leg. So finding that like trust in your knee again is a really big thing, and understanding that it's there and you did all this work, you've done 9 months on it, like you went through everything, that it should be ready to go. And if it doesn't feel ready, just give it a couple practices. And yeah.
I think that's so good. And I'm going to ask Ravi and Christine about that too, how they help. But what I found really helpful when I was integrating back into sport, and maybe this is where Ravi and Christine have helped their athletes, is I would go up to one of my teammates and say, hey, my first month and a half back, I would pick somebody out and I would say, hey, Britt, like, I just need you, every time I make a good pass, I just need you to tell me I made a good pass, because all I'm thinking about is how I don't know what I'm doing. And if somebody is telling me that I'm doing something good, I am going to be reminded that I'm doing something good. So it's an external factor of a reminder that I can say, all right, I am, I'm not doing it. Because how many of us left those first few trainings and we're like, man, can I really play my sport again? Like, can I do this? Can I make those decisions on the fly? And I think if you have somebody, and it doesn't always have to be the same person, but say every time I go into a 50-50 challenge, yes, Jord, go for it. Like just some kind of external encouragement can really help you understand that you are never going to leave that. You're never going to leave a PT session. You're never going to leave your game, your training perfect. You will always make a mistake, and mistakes are good. And mistakes help you grow. And so understanding that getting back into playing is not going to be like, oh, I'm back and I know all the decisions to make that are right now. Just like the PT process, just like learning our sport in the first place, like it is a growth process. And to think of it like that, I think is really helpful. Ravi and Christine, do you guys go and support your athletes when they get back? And what does that mean to you guys as PTs to see them back playing?
Yeah, I think it's good when you're, especially in the clinic, sometimes when the patients are in front of you, because they know what you're looking for and you are teaching them, like they know how you cue, put them with someone else who doesn't know what's going on. Like I will put them with an aide, but the aide knows what I'm looking for. Like I'll be like, just watch this, like have them do something. And then I'm not going to be watching, or I'm watching from a distance. And then like, they feel they're less scared if I'm watching, because it's like the way you're ready to go back is if you're not scared. Like if you're scared, you're not ready. Like
right. And you're making like instinctual movements, not like, oh, I think Christine's going to do this next. And then, How about you, Ravi?
Yeah. So then they just feel like ready to, like, they feel more confident. It's like, oh yeah, you did this good or whatever. And then like, like, okay, you could try some other stuff.
For me, seeing the athlete back on the field or on the court is probably the most rewarding part of doing my job, of being a PT. And you kind of see that whole process. Like a lot of people don't see that, but you see that whole process of when they came in and they had surgery or whether they didn't. and they work so hard to get back to that return to sport process. And one of the biggest things is connecting the physical to that mental piece. The goal is hopefully they're going together, and the rehab should be preparing them for that. But sometimes that physical comes along and the mental, it takes a little bit of time, and especially to that return to sport process. Because as Brendan said, it's like you can do all these drills, but as soon as you get on the court or on the field, it's the intensity changes, you're around your friends, you're more competitive, all of those things change. So that's where there's a smooth transition, if not really focusing on time, but let's say the athlete is hitting those return to play markers of 90% and all those things, then there's a smooth transition of one-on-ones to more open environments, to more reactive based challenges, to integrating to 3-on-3s or 5v5s, like being able to slowly ramp up that process instead of there's this one day you cross that threshold and it's like your return to play. It's like, no, it should have been this process all along.
Yeah, no, it's so, and I hope everybody hears that if you're going through rehab right now, is I feel like confidence is built in that return to play process of, okay, today I got to, everything I do is soccer. Like my thought goes soccer first. Today I got to be a part of our warm-up drill. Today I got to go into to passing. Now I get to play a neutral player. Like those are small steps that are building the confidence. So because if you're just thrown back in, nobody's gonna be confident in that, because you're like, I just remember feeling like, okay, my brain knows what to do, but my body is not there yet. Like my body is not quite there. So that's a really good point. We have about 9 minutes left now. And there is one more question that I really want to get to, because I think that it is so powerful, and I hope that we can all get to it. It is, what has been the most rewarding part of recovery for you? And I think this is, we should look at this as a challenge that we can choose, right? We get to choose what we get out of it. And it's going to be difficult, but there is going to be a reward, an internal reward, a mental reward, an emotional reward, a physical reward. So is anybody ready to share that right away? Brendan? Okay.
Yeah, I guess I can go. I guess one of the things is kind of saying like, this is one of the toughest things I've done in my life, is coming back from this thing. And it challenged me in so many different types of ways, like physically, but also mentally, and just being able to come out of that and say, I was at probably one of the lowest points, and then I'm all the way back up to returning to play and feeling back to my normal self and not having second thoughts about it, is just feeling like a normal person again, and feeling like a athlete again, and just feeling normal. Because you always feel like you're one step behind when you're recovering from these things. You're always feeling like, I'm so close, but I'm so far at the same time. So I guess just feeling normal is one of the most rewarding things.
Do you feel stronger in any way?
I definitely do, both mentally and physically. I feel like I could not do anything, but I tell myself I feel like I can do anything.
Yeah, you can.
Yeah.
We believe in you. Megan, were you ready? You want to share?
I can go. I think for me, getting back somewhat or almost near full function of my knee has been really rewarding. I couldn't bend my knee past like 90 degrees for over a year, or like straighten it. I was like, had 15 degrees off extension. So just being able to have that range of motion, I never thought that would be something that I'd look forward to in life. So just being able to regain that, or being able to lift my leg, it's the littlest things that you wouldn't think of that can be the most rewarding.
Can we all just take a second and acknowledge Megan and how strong she is?
Yeah.
Megan, I don't know if I would be that strong. I don't know. But like you, 9 surgeries, what you went through before surgery, what you went through during it, you, my friend, are very strong.
Thank
And
you.
your perseverance is inspiring.
Thank you.
We've got a lot of people rooting for you now, so we know you can do this.
I appreciate it.
Of course.
Maddie,
or yeah, you want to go? Okay.
So something that's been really rewarding for me, I have like the same idea as Brendan, just like the physical and mental side of it. Mentally, I feel like I've become a lot stronger, and like being able to like look at the positive things within such a like down low situation, you know. So I feel like that's something that's very rewarding.
I love that.
For me, since mine have been 13 and 7 years ago, it's been interesting. But the thing, to everyone's point here is what I've taken with me throughout life at this point. It's appreciating the process of it. It's such a long process, and I've become more focused on how the process is more important than the outcome. Definitely. And if you focus on the process itself, the outcome just comes out the way you want it to, usually. And so that's one of the biggest things. And then just focusing on just getting 1% better every single day, taking the small wins and strides. And it's applied to so many other aspects of my life. And I remember the ACL, my first ACL injury especially, was one of the lowest points in my life. And I know that if I could have gotten through that I can get through the rest of whatever my life is to bring. So,
yeah. I would say, like, I definitely agree with that. I think it's like the physical aspect is definitely there. Like, it's definitely rewarding to see your body like change, but I think it's nice to just be like in a spot where you have the ability to heal. Like, there's a lot of things that can go wrong with an ACL. There's a lot of things afterwards, you could have your graft fail. You can have other things happen. Like, some people never regain their mobility back. So I think the most rewarding part is just being able to to know that I'm healing and I'm gonna it's gonna get better. And just like being happy that like I can go back. It's gonna be time, but like it's better than not being able to do anything.
Oh, so good. Gratitude that our body knows how to heal inside, that we can get better, that we have the ability to have surgery. All these things, I think they're so important to our mindset, to the mental side. Guys, thanks for sharing all that. I think for me, as we start to wrap this up, I don't know if you can read this, Robbie, but it says the process.
Cool.
I mean, Robbie, you guys, I'm very obsessed with the process. Very, very obsessed with it. I feel like ACL, what I learned is ACL rehab is a microcosm of what life is that things will hit you out of nowhere and they will sweep you off your feet and you will be devastated, and you get to decide, will it define you or will it refine you? And I think that we're all choosing for it to refine us, saying, all right, well, I was given this for a reason. I'm going to choose growth in this. I am going to choose that I can show up. And sometimes showing up means bawling your eyes out to your PT, because I did that multiple times. Sometimes showing up means sprinting for the first time, kicking the soccer ball, making a 3-point jump shot, whatever it may be. Sometimes that's showing up, but knowing that you're not showing up for anybody else but you, that you can do this, that you can get through this. And I think that the trust that we've created with, one of the reasons we're doing this is to talk to physical therapists and to people going through the process right now, is say, like, communication is key, right? That's something that I take from all of this, what you guys said. Communication helps build the trust, not only with you and your knee again, but with you and your PT, with you and the people around you. That having what I like to call rad activities, random acts of distraction, having those activities, whether it's your friends or it's learning to play the guitar or doing something creative that taps into that endorphin feeling that you get from your sport. These are really important things to do throughout your recovery, because it allows you to understand that you can be empowered in this process. It allows you to feel like you have a little bit of control, even though we don't have control over a lot of things. And it gives you tools to help you heal through difficult situations, which we're all going to face throughout our life, right? And I think last year we used a lot of those tools to help us get through a difficult season. So, gosh, you guys, I just want to say thank you. Thank you to Matt for putting this on, ACL Study Day. Thank you for bringing us all together. I learned so much from each and every one of you, and I appreciate your honesty and vulnerability, two other very good, important things that we learn in this process, right? But really, just thanks for participating in this. And I hope everybody watching took as much out of this as I did. Thanks for signing up for ACL Study Day and being a part of this. That's it for us. We'll see you guys later. Bye, guys. Thank you.
Bye.